Director of Operations. Just want to introduce him to you, so if I get lost with it. Just a little bit of background. I've been in this system for over 25 years, so I know what a great system we have here today, and as Mo talked about, we really don't want to do anything to mess it up, so that's why it is a big concern for everybody. So who is Sunstar? Sunstar is a county service mark under Pinellas County EMS Authority. I'll just tell you, I have a few slides that probably duplicate my predecessors here today, so I'll be able to move through those pretty quickly. But I wanted to kind of answer some questions I've heard by going to some of these meetings within the presentation as well. And one of those is what is the Sunstar name, and how does Paramedics Plus fit into that? So basically, Sunstar being the county name, and then they have a contractor to provide the ambulance services, and Paramedics Plus is that contractor. I work for Paramedics Plus. John works for Paramedics Plus, and basically we work for the county. We're owned by a not-for-profit hospital in East Texas Medical Center, and we are what's called in the industry a public utility model. Public utility was developed by some really smart people. PhD means really smart, right? Some financial and operational consultants, with the thought that patient care would be #1 focus. Now I can tell you, before we had a public utility model, Mo put up a time frame there with 1987, is we were in a disjointed, disorganized EMS system with little accountability and little organization and very few standards. And by having a public utility model system, we have been able to create one of the premier EMS systems here today that everyone all over the world actually comes here to see what we do here and how we do it. The goal being it's an all ALS system, and we say ALS would mean advanced life support. That means a paramedic at your side that can do whatever you need to be done. Some systems respond basic life support, where EMTs, that means they can do a lot for you, but they may not be able to administer medications or do some of the higher complexity things. So the components that were created that really make the system work was having the authority. Before, there was not very much accountability. Board of County Commissioners is the ultimate authority of the system. Creating a medical director. Back in the day, what would we do for patients? We need guidance. The physician at the receiving facility that we were transporting to would tell us what they thought we needed to do for that patient. So there's, what, 14 hospitals in Pinellas County? So there's 14 different directions that we would get on a given day of how we should treat a patient. This system developed a unified medical direction system. Not only will I have standing orders, but I have the ability to speak to a physician or a designation person by a physician if I need help in the system. Sometimes things get advanced, we need a little advice, we can go online and speak to a doctor directly to say, what do we do now? What's the best thing that we should do? Or run a scenario by them and tell them what we want to do. It also created the contractor. Back in the day, there was about 5 or 6 ambulance services. They were not regulated very well. I can tell you, working for them, there was not a standard of what you carried on an ambulance. We would steal pillows and sheets from anywhere we could get them. But by having this one ambulance service, it really set the standard here in EMS by providing everything a patient could possibly need. And I also want to note that the contract is a performance-based contract, and I think that's one of the advantages of having a private company in here is when you hire a private contractor to do anything for you, if they don't do a good job, you can fire them and you can get another contractor to come in and do what you need. It also created the FD response, which we've talked a lot about, as first response. And then also, CME stands for Continuing Medical Education. That was a huge benefit to our system, where the county has developed a system where all paramedics and EMTs in Pinellas County, regardless of who they work for, receive the same base standard of training of how to treat and care for our patients in the community. So the system design, we've talked about a little bit about first response and ambulance. I hear this question when we go to some of these things about why do I have to wait for the ambulance? ambulance, the fire department got there, now I have to wait, and my loved one is suffering while I wait for the ambulance. The system was set up based on what Mo was saying, is the fire departments are there, the infrastructure is there. How can we get people fast to a patient's side to care for them without it costing too much money? By using the fire department infrastructure, we're able to do that. Does everybody have to be there that fast? Well, the answer was they didn't think so. So we have the fire department getting there within minutes, provide any life-saving measures that need to happen, with the ambulance service, with equally trained paramedics and EMTs, come in, we join together. Together we work very well together and take care of patients. Then that fire service can go back available so that they can be available for the next emergency. And then we continue on with that patient to the hospital for that transport and continued care. And then I just said that piece there. Dual response, we talked about that. Mo mentioned it in hers, but I just briefly want to say that people may think that this is weird that we do this, but 98%, 200 of the largest cities do it this way. It's not odd to have a dual response system. It's considered somewhat of best practice. What they have done, there's a lot of talk that you'll read about, it's called priority dispatch, and that is, do you really need to have everybody going to the minor things? What do you consider minor? And there's a lot of discussion about that. So priority dispatch would reduce the number of some of the dual responses, but basically we are a dual response system. I already mentioned pretty much all of us are trained the same way. Everybody is advanced life support, having a paramedic on their unit. Next slide. I also talked about one medical director. Next slide. One thing I do want to mention, one of the reasons that we have the ability to be very efficient and I think maybe reduction of cost is fire department stations are static deployment of response. We use a dynamic deployment of response, which is called system status management. And basically, you've seen us at maybe 7-Eleven or CVS on a street corner. Those locations are by design. They're strategically located. We change our post locations on every hour of the day. We have a 168 post plan. We have a computer program called Marvelous that helps us predict where the next emergency is going to be. Based on the time of day and day of week, we can predict where the next emergency will be. We can also predict how far our ambulance can respond in a 7-minute time period. And that's how we decide how far apart we post our ambulances, is how far they can get in a 7-minute period to make our response time requirement the county set for us. And we use that all based on historical data. So it's very valuable for us that we can move folks around to where we think the next emergency is going to be. A little bit more about the Paramedics Plus side of things. We employ 540 total employees, 440 are full-time. Those 100 part-time employees help us to be flexible in our staffing, where we can beef up during the busy season, which we're into now. And then when it gets a little bit slower, we can relax our head count a little bit. We have certain requirements for part-time personnel, the number of shifts they have to work. 72.4% of our employees live in Pinellas County. 77% of our revenue goes towards our employees' benefits and salaries. And as Mo said, that we have a 9% cap, and we have yet to meet that cap today since 2004. 5-year contract with 2 3-year extensions. Why so long? Why 11-year contracts? Because it does cost a lot of money for a company to come in and provide 75 ambulances, all the equipment and personnel. We have invested over $25 million into this EMS system since 2004. And as she mentioned, we didn't have a loss. We kind of knew we wouldn't be making money the first year when it cost so much to come in to play, but you know that as a company, and that's, you start to make your money a little bit later, which is why we have a longer contract, 11-year. Next. We are the largest ambulance provider in Florida here in Pinellas County. We respond to 181,295 requests for service. That's about 496 calls per day. That's 132,000 emergency responses. And of these, 102,000 result in a transport of a patient to a hospital. So we're a busy, busy system. We own 75 ambulances. Gee-whiz facts about how far we drive, if anybody was interested, keeping you up at night, wanted to know that information. We drive about 2.9 million miles. All units have road safety. Road safety is a black box that's in our ambulance that tells us information about how our employees drive. So anytime they take a turn too sharp, it'll go off, it'll make an alarm. If they brake too fast, it'll go off and give them a count, as they say. And if they exceed the speed too much, it also generates counts. And we look at that information and we can tell then how safe our drivers are out there, how safe the EMTs are performing their function of driving that emergency vehicle out there. So it's very good information. We have an OMG Wi-Fi. I hope everybody knows what a Wi-Fi is, but basically the bottom part there is all patient reports. All patient reports are completed electronically, and what we do is we electronically sync them so that we have access to them immediately, and to transfer data back and forth between our ambulance and the communication center, we need that whole internet infrastructure, and every ambulance has one of those. Some of our additional services, this is a picture of our critical care ambulance. It transports the more complex patients in the community that are, you may go to a hospital that may not be able to provide the level of service that you need. You have to be retransported. You may have some medication drips on you now that preclude you from going to be in a regular ALS ambulance. This ambulance has a nurse on board in addition to specially trained critical care paramedics and EMTs. We also have mental health transport. These are unmarked vans that work in the system that transport folks to psych facilities. We also have a contract with All Children's Hospital. We provide them with the EMTs to drive those vehicles and help them care for those patients. We also, our fleet department maintains those vehicles as well. And then we provide all the warehouse and supply management system for the entire EMS system. We deliver the supplies to the fire departments, our hub stations, and all that fun stuff. I just think it's fun to share that we have solar panels on the top of our ambulances. When we started using power stretchers to help save the backs of our employees, they take batteries. And one of the last things you want to happen is your battery go dead on you at a shift. Our EPCRs take batteries. Our cardiac monitors take batteries. So we're very battery dependent. And the ambulance itself needs batteries. So how do you keep everything charged so they don't fail and run through a bunch of truck batteries is to use a solar panel, and that helps keep our stuff charged for us. We have 35 of those. We also have, we're going through a remounting process. We're renewing our ambulances, and part of that is clean emissions. So something else that we are trying to do to help keep our community clean. Accreditations. Is it just another stamp? Letters after your name? Accreditation will tell you the level of service you're getting. You know how you go to the Better Business Bureau, or I can't remember that other gal's name that's become big now. You can go on and see how people do. What is it?
Angie's List?
Yeah, Angie's List. It's kind of like that. Is by knowing that we are CAS accredited, which is Commission on Accreditation of Ambulance Services, you know that we operate to the gold standard for the ambulance industry. For CAMES, that's for our critical care ambulance. You know that we're operating at the gold standard. And then the ACE is our communication center. In addition to that, in 2009, the ambulance service applied for and was awarded the Florida Governor Sterling Award. It's really quite an honor to receive this. It's based on the Malcolm Baldrige criteria. And It's a performance management system in your organization.